would like to introduce our speakers today. So in fact, you guys were our original NHS customer, I believe. Yes, Steve Thompson and Paula Wiggins from Somerset. So Steve is Director of Integrated Governance at Somerset and Paula's Governance Systems Development Manager. And we asked Steve and Paula to come along today because one, I'll let them explain their organisation more, but in terms of the scope and breadth of usage across Somerset, it's massive and touches across the whole kind of spectrum of the organisations we represent. But also because they're kind of one of our most established NHS users, the breadth and depth and the way they acquire and use and process data is really sophisticated, and there's some really good lessons learned, some really interesting journeys that Somerset have been on. So we asked Steve and Paula if they'd come and talk to you about that, just to share that experience. So I'm going to hand over to Steve first. And Steve, it would be good if you could kind of just give us a bit of a background to Somerset as a starting point.
Absolutely. Just as I'm doing that, there's someone's wheeling a whole tray of notes down the corridor behind me, which was bound to happen as you hand it over. So yeah, we've got a lot more to go in terms of sophistication, but we are learning lots and doing it. We have a definite vision. So we're a complex combined trust in Somerset. So we're coming from two mergers, one in 2020 and one in 2023. And so we cover acute community mental health and primary care. So we're pretty unique, certainly in mainland England, for doing that. We've got more than 150 sites, 2 acute hospitals, 10 community hospitals, 10 mental health inpatient wards. We've got dental practices, we've got 21 GP practices, all within the one organisation. So as you can imagine, that, as Rhiannon describes, that's quite a complex little system to be able to share and report data on in a consistent and useful way. We've also got more than 14,000 staff and a very devolved approach to governance, naturally, and to leadership, in fact. So empowering people is really important to us, empowering people with their own data. We started using Radar, as Rhiannon says, we were the first trust in 2020 after our first merger. And we had the 2 different organisations, that were merging, one had been using Ulysses and one Datix. So we went out to tender, expecting it to be one of those that we would use, but with a detailed spec talking about that reality of the complicated organisation we had, what we needed, therefore, to be able to support our governance, and our vision of really devolved local ownership of data and learning. And basically, Radar won that tender on that balance of quality and price, and we've been using Radar ever since, and going on that journey in partnership with Radar and working with people to do that. In terms of what we use, it's probably, so Paula is our systems development manager, has been in since the start, and since that, oh my God, we've got a few weeks to learn something totally new moment that was really exciting during COVID as a little bonus. But I'll hand over to Paula to talk about what we actually use.
Yeah, so we use Radar for three main things. So we have the event types of reporting, the risk module, and also document management. So initially with events, as Steve said, we went out to, we merged trusts. So we were looking at the things that we'd used it for previously. So that was things like, the incident reporting, housing complaints, all of the IG modules, the FOI, the subject access, and claims. So those are the things we focused on initially. Then once we kind of got those up and running, and we were starting to use Radar a bit more, we were then starting to focus on other things. So with the events, for example, we use things like we built restraint use of force. We have a mental health trust, part of us as well, structured judgment reviews, and freedom to speak up. So we've just gone live with freedom to speak up. So we're kind of constantly looking for opportunities. So as part of looking for those opportunities, we also went out for a separate tender for the document management part of Radar. So again, we've kind of implemented that separately once we'd identified a need internally for that. Next steps for us, we don't currently have the audit function, for example, so that's another thing that we'll be kind of considering and exploring going forwards, primarily really to help us with a way of looking at the elements of the CQC standards. So we're going to kind of scope that out a little bit more and explore that. But fundamentally, what's brilliant about my role is that obviously there are so many different opportunities we can explore, and what could be, what we could use radar for as the solution, really. So we're always on the lookout, and it literally hasn't stood still since 2020. So yeah. The other great thing I would say, and just to give a shout out to any guys on MBT colleagues who may be listening, that for me, it's been brilliant working in partnership, but also working with other trusts as well, with around developments and sharing, good practice, different ways of doing things. So that's been absolutely fantastic for us.
Sorry, thanks, Paula. In terms of the subject for today around how you guys look at data, was particularly interesting because in Radar there are broadly 4 ways that we can interrogate and acquire data and start to manipulate data. One is our report builder, which often can be compared to Datix, and that's something that would be interested to talk to you about in terms of that, how our report builder stands up against other things that you've seen and used. But we tend to rebrand that almost query builder as ad hoc reporting. We've got our standard analytics, our standard dashboards that you get as part of Radar, and then the ability to make custom dashboards and build them specific for your organisation, and then the ability to take data out of Radar completely and pop it into your BI warehouse or whatever other environment you want to take that to. So it'd be interesting to hear your thoughts and experience around those 4 elements.
Yes, absolutely. So starting with the report builder, we made the conscious decision absolutely not to try and use it to replicate how things were done in our previous systems. That was absolutely critical for us straight away to say, I don't want a central provision of running reports, sending data out, or setting reports up in that way. And basically, I use report builder purely for queries myself. So I will, if the chief nurse comes to me and says, can you tell me about this instance just happened, have we had any other similar, can you send them to me? I will run a quick query. I don't even save my reports because they are unique one-off searches for me, and that's how I use it. And as I say, we'll move on to the other types of reporting that we based our vision on, but I know, Paula, you do use it for a little bit more than that, so it's probably worth you describing that.
Yeah, and I do save my queries, but unlike you. So we tend to use it for things like we've set up, we've got patient search set up, for example, so we could search by our local identifier or an NHS number. And the reason we have that and the reason we use it is because of the complexity of our organisation, we can't link currently to a single PAS system. So we had to kind of use that. We also use it for things like FOI requests and word searches and things like that. Our other teams like bereavement, information governance, PAS and complaints will also use little queries they run. So those are the main things that we use it for. And the other thing really is that always in our heads that it was always going to be about the dashboards. So for us, it was using these query builders really, which is really what they are. It was more about that's a short-term solution, while in the background we were looking at doing the development work around the dashboards. So that's kind of from a sort of user day-to-day kind of use of those. That's what we use those for.
Thanks, Paula. And then so moving on to the dashboards, which is what our whole vision has all been about. So the standard dashboards that come out of the box are fundamentally really helpful as a starting point for us. So what I really wanted to try and achieve when we were moving to Radar, and again, the COVID timing didn't necessarily help that, was some really good vision discussions about what might we want it to look like, what data do we need. And people do struggle with that, as that concept of what do you mean? I want what I had previously, or can it do this? Rather than saying, actually what data do we need out there. And so the standard dashboards help with some of that, but they're also a nice little interim starting point whilst we develop our own. So part of our vision around governance is real data-driven, properly evidence-based. And I would say lucky enough, but it's a deliberate decision in the team and where we put resource to have two fantastic analysts. So I've got two quality data analysts as part of our governance team. Obviously, we link strongly to other information teams in the organisation, but I have two analysts, and a key part of their role is further development. So, but what we will then do is use some of the standard dashboards while we are prioritising and developing those. So we still, for example, use the risk dashboards, and of course they've changed recently and been updated for the risk dashboards. And there are others we use. Paul, is probably you know the ones we actually use more than I do.
Yeah, the one we use frequently, and I'm talking sort of several times a day here, is the users dashboard. We find this particularly useful for our organisation. We've got 770 locations, for example, across our trust, multiple alerts and roles and things that are set up in the system. And we particularly find that useful because unlike the standard filter within the user list, which returns sort of multiple options, it's quite difficult to find out. This user dashboard is like brilliant for us right now. So that's the main thing we use that for. The other thing we do find really useful, again, Steve's just said the risk dashboards have been updated, but there are a couple of risk dashboards around controls and tasks as well that we use. Because we're a devolved organisation, we sometimes get people come to us. We don't know the ins and outs of everything. So those dashboards are particularly useful for us to work out, who is assigned a control or a task, and we can use the filters within that dashboard to search for the actual risk reference number rather than trawling through lots of other ways of doing it. So those ones particularly have been great for us.
And then it's the custom dashboards, and as I've mentioned a couple of times and will again probably, they are critical to our vision for how we want to enable people. We want people understanding data and using it and out there to help make decisions at the front line. I don't want to be saying, here, the data has told us this, go and have a look. We want them to explore it. I have people in my team who will also do additional and look at themes and trends, but it's empowering frontline staff, giving them the skills, the knowledge, and most importantly, the tools to be able to explore that for themselves. So I mentioned the analysts in the team and making sure that they already had those IT skills and knowledge way beyond anything I could ever imagine, as well as those analytical skills, which I can imagine a bit more because my background is maths, and I did at least understand that. I did maths before IT was part of it, unfortunately, but it's really exciting for us to be able to say, what do we want a dashboard to look like? Let's develop it. Let's work with Radar, but let's prioritize. And this one would be really useful for this purpose, or this one might help in this area. And it has really changed the way our organization uses quality data. People, rather than sit back and wait to be fed data and go, oh yes, I'll have a look this once a month when this report comes and see, people are using it to identify their own issues, drill down and go, oh, that doesn't make sense. I'll go and actually look at that particular event and see why it's ended up there and what it might be telling me, as well as trends. And I find it, really exciting. We know how much it's used because right now, since we've introduced LFPSE, we actually don't have the right data in our cube. And those dashboards that people used are no longer telling them the information they need. And boy, are we hearing it. We're constantly, when are we getting this back? When can we do this? When can we do that? So we know how much I guess until then, we just sort of assumed that, well, people aren't coming to us anymore, so I hope they are using their data. We now do know how much. Paula, if I hand over to you, you can actually show people some of what we've done.
Yeah, I think Liv's going to help with this. We're just going to share some screenshots of a few dashboards that we've got, which I can't see right now, Liv. So hopefully you can see that. So the one of them is we developed a service group overview dashboard. So we were looking at all of the different event types on there. So obviously incidents isn't updated, but there are things like excellence reporting, the PALs and complaints. It's numbers of how many were waiting review. So that's a really good one. Again, probably once we've got LFPSE and stuff in the queue, we can start to develop things like that a bit more. The next one that was one of the analysts developed was our dashboard status report, which is great for us because he's also set up a pulse alert so that if the cube's not loading, for example, it will tell him really quickly that we may have an issue on that day with our dashboard, so we can get onto radar about that. So that's really useful. The other one that was developed was around document status. So this is really brilliant for the service groups across the organisation. You can have the overall trust-wide view of policies and documents and how many are in date and all of those things that you need for your KPIs. But also you can then sort of drill down through service group and have a look at your own. So for your own sort of governance meetings, you can review those as well. So and then we've got an example of a more specific one for a specialist group, which is our claims dashboard. Again, they look at high level numbers and things for reporting out on. We haven't given an example of this, but we also use the dashboards for things like our tissue viability team, for example. So they have a specific patient search dashboard that they use for when they're validating their pressure ulcers and they want to make sure that, check if this is a duplicate. We've actually got a dashboard they use. I mean, it doesn't look great, and pretty like this, but it's certainly one that again, they're really missing now because of the introduction of LFPSE, and something that we'll bring back as quickly as we can. So yeah, we use them a lot. And I think also I would just say any sort of development that you're doing around event types, you really, really do have to think about the outputs. And for us, I think that's something that we are doing more than ever now than probably, even though we knew it from the beginning, it really does hit home, and you do realize how much you need to think about those outputs when you're building. I say the analysts are building our dashboards for us. So yeah.
Yeah, absolutely. Very much that we in their reflected glory, because it's brilliant to be able to have those conversations and say, we think this would be a really helpful one, something along these lines, and come back with someone who will come back and say, actually, this is what we could do, and this is how we could demonstrate it. But Paula's point about using analytics not just for dashboards but other tools in there as well, when we've looked previously and said, oh, when you look at a display in radar, it doesn't include this title in there or whatever, and it's really, can we sort by it, can we add that to the screen? The solution often can be, actually, if we can build you a dashboard in analytics, you can have that, and you can do that any way you want. And it doesn't necessarily mean a dashboard in the sense that we've displayed here and Paul has shown you. It can just be another way of displaying those data, and that in itself can be really helpful. And again, I think that's something it probably took us a while to learn and think, oh yeah, I see that now. We don't need to keep trying to make you change the way this bit looks, because we can totally design our own bit this way. Then the last bit to talk about is the bit that we have used least, partly for some of the reasons Paula described. So the integration with our BI warehouse. We basically, when we first started Radar in 2020, we had just merged and we didn't have a data warehouse. That's the reality. We had two data warehouses. We didn't have that one version of the truth. So we didn't have anything where I could say, oh, let's extract to that and we'll be able to do this. So we took the decision to use Radar analytics to create the dashboards we wanted, and with that aim of pulling in some of the critical data like bed days from the warehouse. So very basic integration in. I think if we were to do it now, in our after our second merger and much more development in where we're going in terms of business intelligence, I may do that differently. But it is a really good option to integrate with your data warehouse if you've got a clear data strategy in your organization already, clear established ways of reporting that involve quality as well. And it is actually something at the moment as a short term, while we sort the LFPSE stuff out and the cube, we are looking and saying, actually, let's do a little mini integration. Let's get what data we can out and report it in different ways. So we are there, but it's back to that huge flexibility options to consider early on. It's really important that you say these are all the different ways we can report data. What is it we're trying to achieve? How might we best do that? And you might make a decision to do it integrated or not with your data warehouse, but really think about it, because I think it will. We're going to head that way and see a lot to gain. There are some pros and cons which we'll talk about later, but it's definitely something worth considering. But really, I think that's where we are on the 4 different types of reporting.
Thanks, Steve, and thanks, Paula. And it's interesting to see some of the kind of dashboards you guys have got, but also that thinking about, is it the form that needs amending, or is it that you need to look at the data in a different way? I think it's really useful, and I think we need to get better from a radar perspective at taking you on that journey right from the very beginning of thinking output first and kind of using the right methodology for the right piece of work. In terms of just leading to that, how would you summarise the kind of positives of what we have at the moment, but where we need to be improving as an organisation for our users?
Right. No, that's so. So in terms of the different report types, there are some really good pros and cons of each type. But where you focus as an organisation, I think really well, is that partnership working, that flexibility. So that's for us. That's in our really complex organisation, that is the really good thing about Radar for us. And what I like personally from my central oversight and strategy for governance role is that it's focused on frontline users, and it's focused on, I guess it's designed to be easy for a frontline user, not necessarily for my team. And I don't think that's always therefore the most positive for my team. My vision is to say, let's make it really, really easy for a frontline user. Sometimes might mean we have to do a bit more in the back office and a bit more work, but it gives us that variety of tools. So, you can look and say something like, you look at the report builder and you can say, it's quite slow, and it's not a substitute for Datix as you described report build, but there is a different way of doing things. We can find a way, because there is that flexibility, and as long as you don't get too rigidly into it, that's good. And then the dashboards, I really do believe, as I mentioned, are brilliant for empowering staff and getting that frontline buy-in, and in a way that we were struggling before we had Radar. We really couldn't get to that buy-in in the same way. If you send people a big spreadsheet or a report, they'll look at it a bit, probably, but really, are they identifying things that need to be done and improved? So I think those. Paul, I don't know if you've got anything to add to that.
No, that's fundamentally it. I think it literally is the realization now. We probably underestimated, to be fair, how people use those dashboards now that, especially with the LFPSE one, they're not there. So yeah, that's the sort of takeaway for me really with that.
I think that probably leads on to another lesson from our perspective, is the rate at which dashboards are used, because I think originally it was put into the product, and I don't want to speak on behalf of the product design guys, but as it was something that we thought was the right thing to do and we thought people might like, but actually the demand for it is massive, and that's something we see as a product where actually our product shifting from where we started as a data collection, operational process type tool, we are fast becoming a data resource, and that's becoming the kind of jewel in our crown and that flagship piece. So it's making sure that we match our skills, expertise and resourcing and methodologies in the background to keep supporting you on this journey, you know, as technology changes, because the next thing that'll come once we've sorted all of this element is the AI and starting to really drive insights and have AI pointing us or shining that floodlight on the different insights we should be looking at. In terms of my last question before we kind of go to the floor for questions, but what's next for you guys? Because you keep saying the journey continues, and I know they're getting the LFPSC dashboard right, there might be audits, that kind of thing, but after that, what's the next big project for you guys?
So I'll just answer a couple of things from my point of view. So it's back to some of those bigger pictures, like how do we want to do that data integration and the warehouse, and what do we want to be able to drill down on Radar into the specific event versus what do we want to tie in with other reporting, but make sure we don't get lost in just performance reporting. So that ownership debate, I think, about whether I say, you know, we need Radar to host all of these, because otherwise people will focus just on performance and miss the quality. So there's still some real internal discussions going on there. And then fundamentally my next step is retirement. So and leaving the system and our way of thinking in a clear way with a clear vision about our next steps. But Paula, probably because you're the one who's going to have to live it after the 6 months' time, then I'll hand over to you.
I'm not retiring, so I've got to stay with this. So, I mean, for us, it's really an ongoing project. So, you know, we've got a current project we're working through the elements of that links in with our kind of overall governance plan, and included within that is always the dashboard development. Going forwards, we've still got the joy of transitioning over to version 6 for LFPSE, for example. We're looking at things like reporting diagnostic ionizing radiation incidents for one. There's bereavement changes coming up. There's SJR changes, and as Steve mentioned, there's audit. So I feel like, well, as long as they don't get rid of me for anything else, I'll always have a job, because there's always stuff to do, as long as it's in line with you know, the governance, overall governance strategy, if you like, then always lots to do.
Exciting. Are you guys ready to take questions from
definitely.
Our colleagues? Have we got any questions from anyone? You can either raise your hand or pop them in the chat. So there's one here already in the chat from Ravinder. What reporting tool are you using to achieve this data? Is this analytics? So I think this is one of your custom dashboards, isn't it?
Yeah, so for us, analytics is pretty much all we use for all our reporting. So it is the analytics and it's custom dashboards that we make. So yeah, the vast majority of everything we get will be through the custom dashboards from analytics.
Fab. And is it Wasim? I think it's Wasim, isn't it? I can't work out if it's first name, last name on the...
Yeah, it's Wasim Roger. I'm the Senior Trust Risk and Assurance Lead, and I GSTT, and I manage the team who have implemented Radar. So we're in I know we've spoken previously as well, so thank you very much for the presentation. We're very much in a similar position as well. I'd be interested to hear about just training your staff, because one of the things that we do is we obviously try and produce, as you do, dashboards for groups of staff members so they're able to engage with it and interact with it. However, what we are finding is that people aren't really up to speed on how they're trained on the dashboards and how to navigate, etc. So it'd be interesting to hear what you did to implement that strategically, because it'll be useful for us, I think.
Yeah, and that's so. There's a couple of answers, and none of them are perfect. So yes, I certainly recognise some of that. So we're lucky in that as an organisation, there is real work ongoing for IT skills, knowledge, empowerment on data, and all of that as part of the overall organisation's data strategy because of the complexity of our organisation and the fact that, you know, more than 150 sites, we can't have someone showing someone how to do it there and there. So there is that general bit, and then there's a little bit of making the dashboards as simple as possible, putting a few little clips together and showing. But we also know that there's functionality that people aren't getting out of it, and you know, you think someone's been using it a lot, and then you have that conversation and you realize, God, they haven't even done that bit yet or that bit yet. And some of that stuff that we saw right at the start 4 years ago around the pulse stuff and the adding this in and doing that, we know very few people are really using that functionality as well as we want. So we've still got a long way to go. What our focus has been on is getting the right dashboards to help that conversation at first, but having a little bit of those conversations. I've got a small instant lead team, three or four instant leads, and I've got Paula and her small team, and then my analysts, and it's a bit of all of us doing that as much as we can. But yeah, you know, when I've got more than 14,000 staff, as I mentioned, and we've got several hundred people we really want to be really using it well. It's a slowly catchy monkey approach, really.
Thank you.
Michael from St Nicholas.
Not St Barnabas, are you sure?
It's going to be forever now stuck in my head. Incorrect.
Well, I've got kind of it's a two-part question to a certain extent. You said that obviously you've using the events side of things, people logging those events. I wonder how far you've gone with teams and trying to get them on board to almost, if you like, join the radar side and have forms and everything over into it instead. So, for example, I think you did mention about people requesting records and things like that. We've got ours that get requested online, they come into radar, and then we can process it directly on radar and get got approval for it and everything all through radar. I was just wondering how far you've gone with the teams, and then the other part to that is how much you're utilising tags that come through onto your dashboards.
Yeah, so I can start, but Paula's going to be able to give you a much better answer on both those, really. So I guess, because we were going through those merger processes, to start with, we were just focusing on the events, the standard events types, and I think it's actually during this merger, so 2023, and then rolling out radar across the new wider organisation, we've started thinking about some of those process and discussion issues. So we've got it for a whole load of IG issues and freedom of information, subject access requests, everything. It does use radar, but not things like records. Partly because, as Paul described, we've got lots of different record management systems. So we don't have a single electronic health record, nor do we have a single paper record. It is really complex, our organisation. So we haven't, but Paul has done some great change request stuff and stolen some ideas from North Bristol blatantly and really helpfully, and that community that Paula talked about has been really helpful. So Paul, I don't know if there's anything more you want to say about that.
Not really on that. I think you've covered most of those points, but the tags was the other part of that question, wasn't it?
Yeah, so do you want to talk about tags as well then?
Well, no, you do want to go fast, Steve? I can talk to you about tags a little bit.
In terms of tags, again, we probably didn't use them that well to start with, and we had some issues around people adding tags and really bizarre tags and really lack of control of what people are actually using them for. But this time round, and in this merger, again, to help with the complexity of our structure, so with all of those different sites, different 6 service groups, which would be a whole organisation. So we've got a mental health service group, that would be a whole trust for other organisations, only having 3 tiers. means we've used tags for some of that location work and structure work to help when we run a report. They're also really critical for the document management one, for the different types of documents and all of those. So yes, we've got a lot better now at really trying to tie down those tags and use them. The next bit of work is really to get that better for risk as well. But Paul, I don't know if you've got anything to add to that.
Yeah, I mean, we did have some really, really random tags, I have to say, that I won't even go into right now, but we're sorting that out. So yeah, sites as Steve mentioned, in terms of our organizational structure, where you're kind of limited to the three tiers, if you like. So sites was absolutely really, really important for us, and that is really well used on a dashboard that we had, where you just literally want to filter for, you know, YDH or Musgrove or, you know, any of those locations. So that's really good. And yeah, the risk register, they've proved invaluable with the risk register, and the risk team are doing lots of work on sorting those out. So and we probably would be looking to use them in other areas as well, I'm sure, going forwards, because they're just very useful to have that extra flexibility.
Thanks, Paula. Thanks, Michael. Thanks, Steve. Any other questions from anyone?
I've seen there's one in the Q&A about understanding that the status dashboard status one, and it's an analytics dashboard. But Paula, you know how Gary how and why Gary put that together.
Yeah, so obviously sometimes the dashboards aren't available for whatever reason, or we realised that due to everything we had you going through the cube, that sometimes the display wasn't updating as it would normally do overnight. So Gary put the dashboard together to look at all of the different elements that you can hopefully see on that screenshot, obviously the different event types that we're using it for, and then comparing, you know, numbers of things that had uploaded. And then what he did was he set up a pulse alert, so that in the morning he'd come in, and if he'd received his pulse alert to say that the document cube hadn't uploaded overnight, the numbers were looking slightly different and skewed. And again, users will pick up on this as they start to use the dashboard. He could kind of get in there quick and let us know, and then we can get onto Radar to have a look for us. So it looks a very simple dashboard, but actually it's you know, it has been used. It was used probably a week ago, actually. So yeah.
It takes a lot of putting together in the background, and again, it's back to that, the complexity of our organisation and the amount we want to use different dashboards, and there's no way that anyone in the central team could keep track of all the different dashboards and make sure there wasn't something not happening. And it's that trying to be proactive, because our aim is to say, use this yourself, and what that then means is if people can't, that sort of takes you that step back, and you lose some of that momentum. And I don't want to be a troubleshooting central team that always has, you know, it's great if we know in advance. So it's much more useful than it seems as a dashboard.
Thanks, Steve. Anybody else? Any other questions? I don't think there's any more in the Q&A. Okay, well, thank you very much. And I'm just going to ask you, just as your kind of final point, what's the thing? I know that there's work we need to do and is going on around the cube and getting things in Form Editor, so that actually we don't have to have the cube and this delay in getting data into SciSense and Analytics. But aside from that, what else should we be doing at Radar to support our customers and our organisations?
I mean, you have mentioned the main one from a personal point of view and an organisation point of view is that pace of getting that bit sorted. So that's great to hear. You also hinted at some of them. Is, you know, when we started in 2020, we didn't know what to expect from Radar at all. It was really exciting but terrifying, and that support, you know, we got really high level support discussion, but I think it was still very new to you, and you didn't know the art of the possible really, and how we would need things different. So I think how you're developing some of that onboarding and supporting and really helping people get the best out of radar, I think is exactly the right thing to do. And you know, you've talked through your restructuring, and I think it is all making sense. So it's just really embedding that and making sure that works from my point of view, because I want people to get the best out of a system in my organisation, and I think that's the same elsewhere, really. Paul, I don't know if you've got any extra thoughts.
No extra ones, really. I mean, we're not really that demanding, but I think for us is the pace of things of change for us. You know, things like the custom cube for LFPSE. So because of the impact, you know, that is having on us, but fundamentally, yeah, that's what he said, basically. That's what I'm going to say.
Great, thank you. Well, I'm sure, I don't know if you saw me smiling as the door was opening, because it was Rob Place arriving. We're on site today. So Rob's heard that last bit about the product consultant team that he's busy setting up. So keep feeding back. And, you know, as we're we're calling it kind of incubator phase at the minute, because a team of product consultants are starting to get out there, but we've not really pushed it or advertised it with you yet, just while people are learning and building and growing and bolstering with this BI expertise. Because like I was saying at the beginning, it's quite easy to demonstrate how a dashboard works, and most people can understand and compute that relatively easily. It's that slightly higher level tier, like you say, Steve, almost that mathematical skill of actually this is how we would display that information that you're wanting to see. That's been our resource we've been light on that kind of resource. So in bolstering that as well, we hope we'll start to be able to really start to build more work with you specific to your organisation, rather than just very standard dashboards that we're putting out. But that's great. Thank you everyone for joining. Liv, anything else from you for a wrap up?
That's everything. I think there's just the link to the Radar community on screen now, and just obviously to reach out to your partnerships manager if you've got any queries.
Thank you everyone.
Thank you.
See you next month.
Bye.
Bye. Bye.